Hello, and today I am going to be doing a demonstration of a passive accessory intervertebral dorsiventral joint mobilisation on the thoracic spine on Lola. Lola is a Saluki cross whippet, and indications for this treatment may include reduced thoracic range of movement and intervertebral stiffness on assessment. Grade 3 mobilisations to the thoracic spine use large amplitude movements to the end of range as per Maitland 1977, and whilst there are few studies investigating mobilisations in dogs, Hausler et al. 2010 investigated spinal mobilisation in horses and found it to be effective at increasing dorsiventral displacement of the trunk and decreasing stiffness in actively ridden horses without clinical signs of back pain. And these changes in spinal biomechanics are indicative of increased passive spinal mobility. So contraindications to this treatment might be if there is significant muscle splinting, if you might suspect a fracture, if the dog is ataxic or demonstrating any neurological signs, or perhaps if they are anxious or aggressive. This may not be an appropriate technique to use, and I'll need to adapt my technique accordingly. So as I don't have a handler for Lola, I'm using a licky mat to keep her occupied, and I'm positioning myself to the side of her, and I'm just going to start by gently palpating her and stroking her, getting her used to touch and feel and checking that there's no response on gentle palpation. So I'm going to apply the technique at the level of T6. So I'm supporting with my other hand on her thorax at the same level that I'm mobilising. I'm going to monitor for any reaction, and the expected outcome is to increase the range of movements. Oscillations are completed for 30 to 60 seconds as per Maitland 1967. And currently Lola is not demonstrating any pain response, which may include looking towards me, freezing or growling. She is currently happy and engaged. So overall, Lola didn't demonstrate any notable pain response and continued to engage with her licky mat throughout. For this video, I've only demonstrated one passive accessory intervertebral joint mobilisation, and it would be important when using this treatment to complete further mobilisations as indicated by assessment to reduce thoracic spine stiffness, and then to use an appropriate outcome measure to determine the effects of the treatment. I'm Daisy, and today I will be demonstrating myofascial trigger point release on Thomas. For health and safety, Thomas is tied up with baler twine and is free to move away or demonstrate a pain response if he needs to. So myofascial trigger point release is a technique used on trigger points, and so these are identified as taut bands within the muscle that are highly irritable and can be identified by fasciculation of the muscle surrounding them on palpation. Palpations include if you suspect any fractures, if there's any open wounds, the horse is demonstrating any neurology, or if there's severe muscle splinting. If any of these were present, then you would refer back to the vet for further investigations. So I'm just going to start by palpating over the area, first gently and then applying a firmer palpation, and then when I've found a trigger point, which is usually demonstrated by fasciculation, I'm just going to hold that strong pressure for 30 to 60 seconds until I can start to feel the trigger point release under my fingers. So I'm also looking for any signs of a reaction. So Thomas isn't trying to move away from the pressure, there's no tail swishing, he's still looking very relaxed. So there's no indication at this point that he is in any particular pain. A pain response may be expected, as this is not always a comfortable technique, but it has to be proportionate, and then we can alter our treatment technique. 2008 compared trigger point release to sham ultrasound on humans within the trapezius muscle and identified that it was effective in reducing pain response. Having completed trigger point release on Thomas, there was no particular pain response identified. He remained still and relaxed throughout. It would be important to then identify further trigger points as appropriate and reassess following treatment.